For the next 30-35 minutes, we will have a chance to hear from some outstanding leaders from the field. What I want to do is take the opportunity to invite our four panelists. Let me first start off with Arun Kumar, who's the CEO of Apnalaya, which does a lot of fantastic work in 31 clusters in the M East Ward in Mumbai. He's the CEO. Their main mission is citizens' right and advocacy. They've done some fabulous work when it comes to COVID relief. So, Arun, if you're here, then just say hi so that we all know you're here.
Hi.
Lovely. Thank you, Arun. And then next, I would like to introduce you to Puja Marwah, who is the CEO of CRY, Children's Relief and You, who have been here for a long time. She's been the CEO since 2010, and you all know that CRY is a fabulous organization that does wonderful work with children relief and you. And she's one of the pioneers of bringing HR profession into the field of nonprofit, not just in India, anywhere. And so we are very lucky to have Puja Marwah with us on this panel. Puja, if you're here, can you just say hi so that...
Yes, hi everybody.
Lovely. Thank you, Puja, for joining. And then I would like to welcome the Chief Operating Officer of the ATE Chandra Foundation, Gayatri Lobo, and she manages the philanthropy of the Chandra family. They are very data-driven. They have a portfolio approach, but one of the foundations that really manages through data feedback. So Gayatri, if you're here, could you just identify yourself?
Hi everyone, looking forward to speaking to you.
Thank you, Gayatri. And then last but not least, a colleague of ours, Preeta Venkatachalam, who is one of the leaders in the Mumbai office of Bridgespan, a consulting firm that works very closely with Bain. And they have done some very interesting work in terms of feeling the pulse of the civil society, the nonprofits at this time. And so, Preeta, if you're here, can you just identify yourself?
Hi, everyone. It's a pleasure to be here.
Lovely. So why don't we start off this panel? First, I'm going to ask the three panelists, people in the field. I'm going to ask Puja and Arun and Gayatri in about 5 to 7 minutes from now to tell us what was your response. March 22nd, here is the lockdown. The Prime Minister announced the lockdown and gives 4 hours. And since then, what did you do for your organization? What is the response? Just talk through the immediate response and how you came at that, both in terms of the resources, how you gathered the resources, what you did with staff, and how you focused on the mission. So while you're thinking about that, so Preeta, would you take about anywhere from 5 to 10 minutes to give the high-level view of the survey that you did and the many, many people you and the other folks in Bridgespan talked to? So with that, Preeta, why don't I hand it over to you?
Kash. So maybe to kick us off, my colleague Donald, who's also a co-partner with me in the spend just literally 6-7 minutes walking through a rapid study we did on the impact of COVID-19 on philanthropy and the NGO sector. So I'm going to share screen so that we can very quickly run through it. So very quickly, this was a study, as I mentioned, that was undertaken by Bridgespan over 2 months, April and May, at the start of the lockdown. And what we really focused on was to look at what the sector is doing in terms of the COVID response and how can we actually inspire greater amounts of funding for the COVID response in the country. And we looked at 2 target audiences, one new philanthropic giving from those who had not yet committed then, CSR foundations, a lot of diaspora investors, as well as those who are quick to deploy funds. And that includes PM CARES. Kash alluded to us having engaged with Niti Aayog and the ministries over the last month and a half to try and inform greater deployment of government resources in some ways back to the NGO sector, given that the Prime Minister's and Chief Minister's funds had mopped up a lot of the philanthropic funding for the COVID response. Also spoke to the Give India COVID Response Fund committee, as well as the ACT Fund, who had all committed to the COVID-19 response, but our work sought to inform the thoughtful deployment of their funds. We focused essentially on the response phase. So, looking at a very typical emergency or a disaster management cycle. I know in this webinar, as Kash said, we're looking not just at response, but over the next 2 days, also at resilience and reimagination. But definitely, as a country, in April and May, and probably even into early June, we were very much in the response phase. And in fact, in parts of rural India, also in the preparedness phase where the pandemic hadn't yet spread. So a lot of the survey that we did and interviews that we did suggested that philanthropies and nonprofits were, having bulk of their resources addressing the response as opposed to recovery or resilience at that point. Through our study, we found that there were 6 unique roles that philanthropy can play. The first one was just the rapidness of responding to the pandemic, given that the government has taken a while beyond the overall government centralized missionary response to healthcare, whether it's testing or treatment. For example, the Omidyar Rapid Response Funding Initiative has funded over 20 initiatives, largely NGO and foundation led, to respond to the healthcare, edtech, and other areas of the COVID response. The second was Marico, which, along with AT Chandra Foundation, set up a COVID challenge fund to support innovation, whether that's in products or networks, and maybe Gayatri might touch a little more upon that. The third area is really, which we'll talk more about, is about inequities. And India historically has had several structural inequities, whether it's gender, caste, classes, elderly, etc. And we found that several foundations, as well as nonprofits, and Apnalaya, HelpAge, etc., can speak more to it, but several of them really mobilized to address deep structural inequities among vulnerable groups, very much at the start of the pandemic. The fourth specialized area was where it required very localized response, because the government, at that point, of course, the lockdown was very much central government led, with some of the states rallying, but very much looking at the community led approaches needed philanthropic and civil society, such as the Rural Coalition, to respond to the pandemic. On collaborations, we saw both on the funding side, like the Give India Fund that Atul, Govind, and others put together very rapidly to mobilize institutional and retail funding, but also a lot of innovative collaboration on the action side. So, for example, the Catalyst Group brought together over 150 organizations to reach about 2 million beneficiaries for healthcare and livelihoods. And finally, of course, a lot of the NGOs like Piramal Swasthya or Wish Foundation, Sneha, etc., are working with governments at the central, state, or local government level, particularly in the area of building health systems capacity, given that it's a pandemic of such large proportions that hit us. We tried to focus in our study on areas that were getting a lot of attention in the first 2 to 3 months of the pandemic, and that was largely in the health side and the socio-economic needs. And whilst everybody knew that NGOs and philanthropies are focusing here, what we found in early April was not as much clarity on where exactly the money is going. So on the health side, we broke it up on the care continuum to look at prevention, which includes things like hygiene, contact tracing, quarantining, sharing more information about COVID, etc. Then, of course, screening and diagnosis, which was largely government-led, but a lot of NGOs helping screening and door-to-door identification of either suspected or at-risk patients. And of course, treatment control management, which was again largely government-led, but NGOs and philanthropy supported. And similarly, on the system side, we saw a lot of NGOs probably have an uptick of what Kash presented as a positive upside on the resourcing side in the early days of the pandemic, because a lot of NGOs that are focusing on service delivery of health or health technology or indeed financing for health did receive more resources and support, and also saw more opportunities for partnership. But of course, as you'll see, this came at the cost of several other health needs beyond COVID. So whether it's tuberculosis, cancer, and several other disease areas, all of them were badly hit. On the socio-economic side, of course, the media focus was a lot on basic needs and migrants, but also economic stability, not just cash transfers, but also livelihoods creation, as well as psychosocial supports. The two bad words, mental health, has now come to the fore finally in India and is receiving a lot more mainstreamed attention from funders and providers alike. So we saw a lot more attention going towards how do you deal with stress and anxiety. So overall, this is the framework that we looked at in looking at the funders and nonprofit response. And I'll hand over here to my colleague Donald to talk us through some of the organizations and learnings over the next 3-4 minutes.
Great. So for the sake of time, I won't go into each one of these slides in detail and just present some of the highlights. So on this slide, we have the 15 organizations that we profiled through their work, mapped against the framework that Preeta just presented. And I think that what you'll notice most starkly here is that many of the organizations are stretching across various elements of the framework. So versus focusing on one specific area, spanning across both health needs and socioeconomic needs. And I think this goes a lot to what we've been talking about today in terms of Kash's framework of going both kind of beyond the core mission, but also expanding into other areas. On the next slide, we really deep dive into the unique role of nonprofits in addressing marginalized populations. And this was a specific focus in our work because we have seen that the COVID crisis has disproportionately impacted vulnerable populations. And I think that's not a surprise since it's the systems that are responding to the crisis are the same systems that have led to these inequities over time. And a lot of attention has been given to the migrant worker situation, and rightly so. But there are many other vulnerable populations that have been deeply impacted by both the crisis itself, the disease itself, as well as the response to the disease. So I won't walk through each one of those, but just saying that we saw a very strong role that nonprofits were playing in addressing the needs of vulnerable populations, and often based on longstanding relationships with those communities. Finally, on the next slide, we also saw 3 big overarching challenges that organizations were facing, and these mirror a lot of what Kash talked about earlier. First, the safety and morale of staff, particularly given the lack of availability of adequate PPE and its disruption to the normal ways of working. Second was the repurposing of resources towards critical needs, particularly social economic needs, but leading to resources being taken away from equally important areas, maybe less urgent in the immediate term, but critical for kind of achieving long-term development goals, but also critical to even kind of containing the COVID crisis. As we think about important comorbidities such as diabetes or hypertension, that those have been kind of seen less attention, but are critical to actually containing COVID. And finally, the adoption of technology that we've seen both as a great opportunity, but has been a challenge, particularly for organizations or more remote locations, and have to find ways to often use several different platforms to reach their target populations in a remote setting. So all in all, I think while there was some more positive data presented earlier today around organizations feeling like there was some positive momentum coming out of the crisis, we also see some pretty stark challenges. And particularly as we see reduced CSR and philanthropic funding coming in the next few years due to reduced corporate profitability, as well as some diversion of that into funds such as PM CARES, and inevitably greater needs, both in terms of meeting immediate social economic needs, but in terms of the investment that is required to make the shifts that will be needed to successfully deliver in the new normal. So we are seeing a need for kind of philanthropy to really step up and think about this situation, which we believe could be existential for many.
Lovely. So Donald and Preeta, thank you very much for sharing this. And it's a good compliment because from the quick top line survey that we did, we seem to see a little more on the positive side, a lot of people sitting in the neutral column, but your survey, which really required you to talk to a lot of people, seem to be putting the weight around what they are saying and a little more realization of what the realistic assessment might be, especially in terms of the funding constraints that people seem to see coming, but also some positive signals in terms of how people have really adopted technology. So hold your questions for for Preetha and Donald, because I want to turn to the panelists right now. And so if we can stop sharing the screen. So what I want to do is I want to turn to a panelist, and Puja, can you tell us, the lockdown happened, you're in charge of this organization, you heard all the surveys, what did you do? What ran through your mind? What did you do? Take us to the first 30 days.
So I think the first thing that definitely struck us was that to give you context, most of CRI's work is in rural India. And the focus is on the last child, so very remote areas. And so one of the first things that struck us was that if our children are out of school, they straight away lose the protection of the space, the provision of the midday meal that is very often, for so many of them, the key meal of the day, right? The main source of nutrition. And of course, there was some realization that we had just been celebrating some very good impact indicators from the last year, and we realized a lot of these battles are going to be pushed back. You know, whether it will increase children's susceptibility to labor, to marriage, to drop out from schools, and of course, the huge challenge of the digital divide. Because a lot of people have been telling us that that's the solution to the pandemic, but the people that we work with, we ran surveys and we found that the access of children to even smartphone devices is less than 12%. So it really was a bit of a fallacy in terms of how we get access to them. So a couple of things happened. Externally, we sort of said, okay, we have to do two large prongs of our work. One is we have to continue to do what we are good at, which is actually local level advocacy and support to local duty bearers like Anganwadi workers, ANMs, etc. How do we ensure that the services are still reaching children? So for example, if there is a state has announced take-home rations, instead of the midday meal from school, how can we ensure that that is reaching our families? So the local level partners kicked in almost immediately with what is their comfort space, which is really advocacy, ensuring that everyone is doing what they are doing. But we also realized that in this situation, there's going to be stark hunger. And we did something we haven't done for 20 years, which is we started looking at the distribution of dry rations. This was, as we foresaw, hugely expensive, hugely logistical. But we realized that our local level partners and the community demand was so high that even before CRI managed to raise the money, the partners had started running with the money that they had already from us. So I think what we did do was a lot of conversations on, the existing funds that they had and how could they use it for their COVID work. Also, of course, I think we were all blown away by the sheer raw courage, I think, that people have exhibited across the country. They put themselves at complete risk to sort of go out and do that. Internally, what we did was we very quickly put together a donation appeal where we divided it into, as I said, there were two parts of it, which was our usual work, which was awareness, advocacy, doing COVID awareness packages, getting them translated. Wherever we found that wherever we already had a digital outreach, like we had an IVRS, which we were using for malnutrition messaging, we were able to repurpose that to COVID really fast. Yeah? So in fact, one of the things that I personally have felt is that I wish we had been far-sighted enough to have had the IVRS in place for all our 3.5 lakh children, and we didn't. So that's one of the things that gives us purpose as we go forward. And the second part was, as I said, stuff that we were not used to, which was rations. We collaborated with mostly giving platforms and digital platforms. We also internally we just redid our budgets. So we almost by the beginning of April, had new budgets where we realized that CSR funds will dry up. And CRI has gone through this before, where a disaster hits the country, but our regular funding becomes a disaster, right? The regular work. Yeah. So I think there was a lot of thought around how to message for that, to sort of ensure that we kept raising money for our regular work. And most of our work is, most of our funds are retail. So that's where our focus is. We have a few large funders, all of whom wanted to do something extra for COVID relief, but wanted to do it in their geographical areas. So what in the end happened was the kind of support we got. I must confess that from the first week of the pandemic, we were committed or promised almost 10 times the money we actually got from the corporate or institutional side. But the response of people through platforms like Give, through Facebook, through Paytm, every digital platform we were on Keto has been amazing. So internally we found that our functions reacted, I thought, with great agility. So like I said, we had to cut budgets and we immediately cut our costs down by almost 90%. We had to cut salaries, of course, which was not so nice. But the way people adapted to work from home to find meaning for their work. So volunteers moved almost entirely online very quickly. So we, in fact, somebody was laughing, saying that we got the most fabulous interns this time from big business schools because they were not getting other internships, and CRI was actually ready with virtual internships. So it was also a strange thing of an opportunity for actually doing a lot of awareness work. We felt, a lot of, we could run webinars. People were finding influencers were easier to come by. Friends who run media networks who would have never given us one paisa of free space before did. So it's been a mix of both understanding both the challenge of trying to move a very large organization, but it's also been a lot of entrepreneurship by young people, by people throughout. Like some young people in program have come up with these modules that they can deliver through various methods, and they run with it. So it's been a combination.
So lovely, Puja. I know you have a lot more to
not at all.
What's fascinating about what you've done is you've been doing two things at the same time. When the pandemic hit, on the one hand, you had to respond, which you did. You've repurposed the capabilities of your organization. And in some cases, your partner organizations in the field, they ran ahead. They started doing the stuff. So there was a repurposing, meeting the immediate needs. Yet at the same time, you did not get carried away because you still kept an eye on the long vision. What is the core mission of your organization? And you already had the forethought to say, we will take a budget cut. We will make sure that the long mission is preserved. And you started raising money for that already, even though a lot of the money. So it's really immediately attending to the pandemic without losing sight of your long-term mission. That is absolutely phenomenal, because very few of us can do two important things at the same time. You've shown us the leadership, and I'm sure there'll be a lot more questions pressing on how you managed to do both at the same time. Let me quickly switch to the funding side then. So Gayatri, if you're there, could you just tell us that as the Chief Operating Officer of the Chandra Family Foundation, and also given the very active involvement of the Chandra family, both Amit and Archana Chandra, how did you approach your portfolio of the funding? What did you do, etc.? Pretty much like what Puja told us in about 3 to 4 minutes or so, and then we'll move on to Arun.
Sure. So your first question was, what did we do as soon as lockdown was announced? We actually started our COVID relief work before the lockdown was announced. So when we started seeing what was happening in Italy and Spain and New York, even before the Prime Minister announced, we quickly repurposed the team. And just to give you a picture, the team was of 6 people, of which 4 people joined after Wuhan had their first case. So we were, 4 brand new team members. So we very quickly repurposed to see what the foundation can do to be relevant to both the government, but also, people on the ground who need support. So we immediately started with just donating PPE, N95 masks. And I think the advantage that we had was we started collecting a lot of market intelligence very early on. So with that, we were able to create templates of what kind of PPE suit do you need to be donated? What's actually going to protect our doctors? This was before the government had certifications and specifications. Our team had created this checklist, which strangely enough came back to us a few weeks later saying, you guys should look at this template for donating PPE kits. And in fact, one of my team members who's on this call is one of the ones who designed that. So with that knowledge, we were able to build models. We were able to not predict the disease curve, but we were able to draw kind of, place bookends to see how bad can it get, and therefore what do we need to do, and how, what's the worst that can happen immediately, what's the worst that can happen over long term. We were able to build out these models and then see, therefore, what should the philanthropic community be doing to respond to this disease, and also the government. So while we continued doing donations in terms of medical equipment, we also started looking at the food relief front. This was early April. The PDS system had not yet kicked in, but we knew from the NGOs that we work with that people were not able to get food because they were in lockdown, and even many of us struggled to get the kind of food that we wanted. What we did was one of the largest food relief programs in Bombay, where we were able to distribute 70,000 food kits within a span of 7 days across 5 wards in Bombay. Now, this was not something that we ever thought as a foundation we would be able to do, and I don't think we could have done it without the NGO partners on the ground, without the government support, and also without about 400 volunteers who stepped in to actually turn this around. It was very, very intense, including getting calls at 1 a.m. from the police saying we're arresting all your volunteers for being outside. But it was an experience that we all would choose not to live again, but we're very happy with the impact that it was able to make. And again, at the end of every piece of work that we've done, Kash, like you alluded to, we're very focused on data and templates. So we created templates which were, for any other foundation to use. Our philosophy has always been open architecture, even in the core work that we do. So I think over the last 4 months, we've deployed about 10 crores towards COVID relief in Mumbai and Maharashtra, focusing largely on Mumbai, but also rural parts of Maharashtra where our foundation does work. I think we've also been able to be fairly nimble in terms of the kind of support that we've given, and be a little more innovative. I think being a Indian family foundation gives you that ability to quickly think on your feet and see where you can be useful. So along with the templates that we shared, we also focused on innovation, and like Preeta mentioned, the Marico Innovation Foundation. We're also doing a very large seroprevalence study along with TFR and VMC to understand the level of antibodies in the population in Mumbai. But I think what all of this was very exciting and very, very useful work. But I think what kept our team up at night was the NGOs we work with. If we know that we did not want to repurpose the money that was committed to NGOs towards COVID relief. So we said, we've committed some money to you, we will continue to give you that. But I think too, we also, the team spoke to every single NGO that we support to understand where other funders have pulled out, to see if we could step in and how much we could step in to support them. So we created a framework that could help us do that. And I think the team on its own, having done this work, a lot of us have given up to a month's salary as personal donations to various NGOs that we work with, because we felt that a lot of them are back on salaries, and teams are being affected, and the least we can do on our personal front is this. And I think the last thing I just want to talk about is because of the work the foundation has been doing, we've we've been able to collaborate with a lot of other philanthropists so that they are able to strategically give their money towards COVID relief. That's been really helpful. I won't name the companies, but we've actually stopped some companies from investing large amounts in production of ventilators because, we had done those disease curve models and realized that the government has already ordered enough, and beyond this, you're actually going to be creating excess capacity, whereas that funding can be used, for actual relief on the ground for migrants or like the work Arun has helped us with the food relief on the ground.
Thank you, Gayatri. And what's inspiring about what you've done in the foundation is you've been a little bit ahead of the curve. After all, you have the resources in terms of the money, but you also have the foresight as to what's happening elsewhere, both in terms of what you do with repurposing your organization, providing the data, but also having the foresight to know that NGOs who are doing the regular work, they might fall short, and also keeping their best interests at heart. So very similar theme to what Puja walked us through. With that, Arun, let me turn to you. In terms of response on the ground, what did you folks do, and how are you looking at going forward in the future?
As an organization, we find ourselves in three spaces: implementation, research, and advocacy. And this has actually allowed us to adapt to the situation when the program delivery on the ground became very, very difficult. So we kind of leaned towards research and advocacy. And we thought that probably this is the time to consolidate what we have been saying for many, many years, which is basically to improve situations on the ground, improve basic amenities for the urban poor. Our discussions internally have kind of hovered around 5 issues: financial stability, social relevance, visibility, trust, and agility. In financial stability, as of now, 13% of our funds come from individuals, 76% from grant-making organizations, and only 11% of our resources belong to the CSR bracket. Now we are aware that we need to diversify it further. 13% from retail is just not good enough. But given the shrunk CSR coffer, and thanks to the PM CARES and dwindling economy, we feel good that only 11% of our total dependence is on CSR funds. Even before the COVID-19 and the lockdown could hit Mumbai, we had begun to assess the situation in order to take necessary steps. I think by the end of February, we had communicated to all our funders about the ground situation, difficulties in completing the tasks planned for March. Even before the government announced 3 months of relaxation in completing the financial activities, we had secured approval from our funders for the carryover of unutilized funds for supporting our staff and offices, even if no program activity was going to be carried out on the ground. We had done that by the end of February. Some of our social media write-ups on the subject were picked up by many thought leaders in the sector. I remember IDEA published one article on 16th of March using some of the points we were making about what the funders may want to do in these times. This was again picked up by another article in LinkedIn. We very quickly began to revise our work plan and the budget for this year. We brought down our budget by 38%. And this was rather painful because it was going to be a year of expansion for Apnalaya. We had plans to take our activities to 3 new geographies and intensify some components in the current locations. Yeah. Now, the revised budget is 13% less than the actual expenditure last financial year. Of course, we have 8 more months to go in this financial year, and one big ticket proposal has got deferred. If that comes through, it would mean 6% more growth for us. We hope it happens by September or October. But one of the most rewarding aspects of our reliance on grant-making organizations is their comparative stability and certainty. So just to give one quick example, 93% of our revised budget was raised or received in the last 3 months. The point about social relevance, we feel that resilience of a social purpose organization substantially depends on its social relevance. The fact that a medical crisis has overnight turned into a humanitarian crisis is that organizations like Apnalaya are social relevant. The current crisis has come with a silver lining, to use your telling phrase, Professor Kasturi Rangan. The demand for an enhanced primary healthcare system, a universal access to food security, delinked from the ration card system, a relook at the relationship a city has with its workers, and the overall disenfranchisement of the poor have been some of the burning issues before us. Today, I think they have become even more relevant. In terms of visibility, I think just social relevance is not going to accord us resilience. We need to communicate our relevance, make the point repeatedly in the larger ecosystem. I think we have begun to do that with a fair degree of success. Apnalaya has had 25 media mentions in this year so far. And we have written and published 4 articles in different journals. We have featured in 2 TV interviews. We were also approached by a number of organizations in their ideation processes on the current issue, including UNICEF, Wipro, APPL, Brisbane, we saw the presentation, Ernst & Young, and so on. It has happened because I feel we have spoken and written about what we feel without fear. And we have done that with evidence, data, and research. We have continuously sought to move the margin to the center, so to speak. Rigorous implementation and unwavering advocacy, we feel, creates trust. With regard to trust, I would like to mention one data point. 53% of the 6.5 crores that we raised in the last 3 months for our relief work was actually through funders and philanthropists approaching us. Only for 47% we reached out to donors proactively. We feel this could happen because of the trust we built and transparency that we illustrated. We share daily updates in the public domain on all social media platforms, sent emails to all our supporters. We put out every penny raised and utilized in the public domain at a regular. Even if we look at the money that we have raised for relief, 16% is from CSI, 23% is from individuals, and 60% from the grant-making organizations. One of the reasons why the share of grant-making organization is so high is because we involved even those grant makers in funding relief who has still not started supporting our programs. We feel we built a relationship which we hope will translate into support of programs as well. The last point is about agility. We feel that some of the decisions that we took required very quick thinking, quick decisions, reducing budget by 38%, being a rights-based organization, taking up relief distribution at such a scale. Some of these things would not have happened if we were not agile, and perhaps there was some degree of brevity as well. I think I was lucky. I was lucky to have a super supportive team. I completely empathize with organizations which had to reduce salaries or lay off people or bench people. We have not done that. So far, we are continuing with each and every one that we had pre-COVID. One of the point about agility is that we started a consortium to reach out to people to optimize our relief work. We started very tentatively. Today there are 13 organizations in that consortium. we felt the need to collaborate and collaborate with as many organizations as possible to cut down duplicity, to share information and materials, basically to optimize reach and meager resources that all of us were working with. As I said, I was very tentative about.
Can I ask you a question, Arun? And I think this question applies to all three panelists as well. And then maybe right after the question, I'm going to let those who have joined this workshop meeting to raise your questions in the chat box so we can ask the panelists. As the three of you outlined what you did to the response, what strikes me if I were to focus on the silver lining, because as you rightly said, Arun, it's not just a medical condition, it's not just the pandemic. The consequence of the pandemic leading to a human crisis in many different forms has somehow sparked the conscience of society. People are willing to give. The philanthropists are able to give quickly because they sort of realize the human crisis and it hits you right in the eye. And as a result of that, you have some, not just agility, but you can also be creative about how you can marshal those resources. First of all, to take care of COVID relief, that's what they're giving you money for, but also to plan out. So are we to say that both the philanthropic nature of our giving in India, the collaboration of the other NGOs in India, there are so many NGOs collaborate on the ground in order to be beneficiary, has all that improved for the better? Should we see that as silver lining when we come to the new normal, that we'll be a more cooperative, more collaborative with the government as well, and more philanthropic money coming into our sector? How can we leverage that? That's a quick question for the panelists. If each of you would take like 30 seconds to respond to that, then I'll open it out to the participants to ask you questions.
So two things, Kash. One is that definitely we've seen a lot of people responding to these visible fault lines in our society. Yeah. I think a lot of people were not aware of the amount of probably just, for example, casual labor and what that has meant for us as a society. So I do see a lot of generosity, a lot more philanthropy, but I do have a little bit of a warning from being in the raising of funds, is that there is a need to move it from immediate relief towards more long-term work. So I think the need for organizations like ours and what Arun was talking about, actually talking about the long-term impact on the same communities who we were responding to as an immediate need, is something that we will need to put in place. So there is a little fear that, it will get confined to sort of, very relief, immediate sort of work, and you need to move it beyond to more long-term work. So that's my, I think, my first response. And collaboration has been amazing to me, that organizations, the livelihood space, have got together and raised resources, etc. I know of almost 25, 30 organizations that have got together in the rural livelihood space and have been funded by philanthropists to do long-term livelihood change work. And I think for a lot of us, just simply saying, okay, maybe you have raised the money, but I have the hands and feet, so I'll do the distribution for you, doesn't matter. So it's been amazing to see that collaboration.
Awesome, because that's what we heard from Arun as well. So Gayatri and Arun, your response, is that the silver lining we should look forward to? And of course, Puja tells us that we should also make sure that funders give us the money for the core mission, which is the one that will sustain us in the long run. Gayatri?
Yes, absolutely. I completely echo what Puja said. I think not just NGOs collaborating, what I've seen is philanthropists collaborating to make larger impact. So that's been a very interesting, place to be, because one, there is so much you can do on your own, but with many people coming together, it's actually, you can actually change move the needle completely. So that's been very heartening to see. We've had several philanthropists, both Indian and foreign, reach out to us to understand the work that we're doing so that they can do similar work or piggyback and join forces with us. So that's been really great. In terms of the long term, again, completely agree with Puja. I think what this disease has done is actually show us so many things that need to be fixed in this country, in the city, on urban planning, on health infrastructure. So I do have some amount of optimism in thinking that these are things that will get fixed longer term.
Lovely. So, Arun, I'm going to turn to you to answer that question. Meanwhile, if you have any questions of the participants, can you please chat it in? We won't have time for all questions, but we will take a gestalt of the questions, so you'll have the chance to interact with the participants. Arun, let me turn it over to you while I glance at the chat box of questions. Arun.
I agree with Puja and Gayatri. But I also feel that the silver lining is not only towards philanthropic response or the government's response. I think there is a great opportunity to look at how the civil society is going to respond to this crisis. And I'll just point out at the migrant workers situation. Just in the month of March or beginning of April, the city, Mumbai, for instance, didn't even know the exact number of migrant workers it had.
Yeah.
Now suddenly we have kind of awakened to this phenomenon called migrant workers, and we are talking about 25 to 30 lakhs migrant workers trying to return home. So I feel there is a huge space for social advocacy where we can look at the relationship the city has with its working class population. I think that kind of collaboration has opened up, and I hope, and I completely agree with Puja, but I'm kind of hoping against hope that this support will not continue only for immediate relief. Let's hope that the philanthropic world also continues to help advocacy related work so that systemic changes do take place.
Awesome. So there are lots of questions coming in. One of the questions has been that with so much of funding and so much of support coming directly for COVID relief, are we taking our eyes off some of the core issues in society? It might be children in Puja's case, it might be the rural workers, it might be what's happening in the agriculture side, it might be urban poor. So the question is, what can we do as civil society leaders to get us back on track? That's the spirit of 2 or 3 questions. Any thoughts, advice, any?
I think one of the things that we've been trying to do at CRY, at least, is very quickly, by the time June came along, to actually try and see if we can start changing the conversation to recovery and resilience. To say, okay, right now you're not seeing it, but children are going to, for example, drop out of school and fall into labor or child marriage. So actually run very concerted campaigns for awareness, as well as and even fundraise for it. So I think to make the invisible visible is the task for civil society right now. To say these migrants, just because they're no longer on your roads doesn't mean they're not somewhere. They are somewhere and they are going to need sustenance. And I also know there are a lot of civil society organizations who are now focusing on to make databases of what is getting made available to returned migrants and how to ensure that they are able to access those entitlements. And I know that people are having conversations with Niti Aayog to farmer rights, or to look at how can you actually create more access for markets. So a lot of conversations have opened up that otherwise were being ignored. So I think it is our job to just make a huge noise about it.
Lovely. The discussion has been fascinating. Essentially, the theme that has come out for me, looking through the chat and talking to our participants in the group, they are essentially saying that, look, we have done a lot of work which might look like mission drift, which might look as though we are going outside what we were supposed to do, but that's the calling. We had to do that. And we try to be innovative because society has been generous and they've given us the support, both in terms of the partner organizations on the ground, funding organizations, etc. So we've sort of worked collaboratively to address the immediate crisis. But a number of the chat comments are also saying that there are going to be second order effects that's going to go way past the pandemic. We will find a medical solution. Our ingenuity will come into play. And in fact, we should be proud. Has been the there are 2 generic licensees of the antiviral medicine, remdesivir, which is being produced. India got the first 2 generic licenses. And when the vaccine comes out, India is the largest producer of vaccines, and they have a license from the Oxford University vaccine. So we will be there, but the second order effects will be long lasting. It goes beyond. So the question is, how do we take this new resurgence in society understanding what these core issues are? How can we make the invisible visible? Can we take this repurposed support we are getting and then go back to the core of what we are all here for, the civil society? That seems to be the crore rupee question, that we have to ask. Tomorrow, we will go into thinking about what does resilience mean? Many questions. How do we operationalize resilience? But now I want to close by thanking Puja and Donald from Bridgespan for their wonderful research that they shared, but most importantly for the 3 wonderful participants, Arun Kumar, Gayatri, Lobo, and Puja Marwah, for sharing your insights and wisdom. Thank you. Thank you very much.
Thank you. It's been a pleasure.
Thank you. Our pleasure.